10% over the last 10 years on average.
Stacey Hennon, I'm the Director of Grant County Social Services. I'd like to go back to Representative Westrom and talk about the state operated services staff, and that's correct. That's absolutely correct that there were several. There's a whole facility that was staffed and didn't have people there. But part of the reason that that occurred was because the legislature didn't allow them to lay people off without a format, and that format took several months to continue, and I don't know, I was on that committee, and I don't know if the recommendations at the end of it really answered the questions the legislature asked, to be frank, but the reason that state operated services staff weren't laid off is because state operated services didn't want to do that. It was because of the legislation that passed, and I think that it's a valid point that Health and Human Services is 30% of the budget, and is going to be probably 32% of the budget in the upcoming biennium from what the projections are. But a big portion of that Health and Human Services budget is insurance, is medical assistance. And a big portion of that medical assistance is your elderly population, your children, and your vulnerable populations. And I guess I have concerns when the terms welfare get used to describe Health and Human Services, because truly, Health and Human Services protects some of the most vulnerable parts of your society. And we have lots of unfunded mandates that we do on a daily basis, child protection being one of the most significant ones, adult protection. Those are not the bulk of the Health and Human Services budget. About 75 to 80% of that 30% is medical assistance, is insurance.
I want to come to the day when I can say that we're helping the vulnerable, and that's all we're helping, those that need it.
Yeah.
Not the abuse, not the EBT cards that are being cashed and they're going to the bandits and they're winning money on yours and my dime. We're dealing with that. I don't know how much we're going to save should we have that, but those are the kind of things that just frustrate me. And we let go on, and I keep saying to those that are against that, do you realize the folks that really need the help are getting shorted here?
Well, and I wouldn't disagree, but if you were to take the food stamps and those programs out of the entire Health and Human Services budget, it's like 5% of the budget. It's really, I agree that there could be reform in those areas, and I agree that that's appropriate to have reform in those areas, but that's not going to save you the millions and billions of dollars that you need to save. When you start cutting Health and Human Services, you're looking at your CCSA grant, which both your proposal and the governor's proposal looks at cutting the CCSA grant. That is the only funding for child protection.
I just want people to be comfortable that they know that their dollars are being spent and not being abused. And
and
you do too.
Yeah, I do. You're right.
And that's where we're at.
And I agree
that's where this voter ID thing comes in. We got into that big discussion too in Morris. We really don't need it. We really don't need it. Well, the public is expecting it now. They're demanding it. Because of the inconsistencies and some of the shady elections we've had lately, Acorn, I mean, I can go on and on and on. And it's gonna disenfranchise people because they're gonna have a $6 photograph on a piece of. I'm sorry, if you're really seriously about your voting, you can get that. You're gonna have to cash a check anyhow.
Well, and I absolutely agree with accountability.
Yeah.
Accountability for Health and
That's the word.
Services.
God, I went through a lot of words just to say accountability.
I believe in accountability. I do.
Politicking.
I just so want people to understand the vulnerable populations that could be damaged if Health and Human Services continues to be such a target for all the governors.
It's a target because it's fake.
I know.